Now moving towards the factors that actually affect the furcation. So let's start it. Bismillahirrahmanirrahim. So local anatomic factors. When you do clinical examination of the patient, so it does not only identify the furcation defects but it also tell you many about local anatomic factors. Okay, that will affect the prognosis. Radiographs will not provide a definitive classification of furcation involvement, so you require actually additional information or data in order to plan the treatment. Local factors that is very important, we will study one by one. Root trunk. Root trunk is a very important key factor in both in development and treatment of furcation in the root trunk length. So basically it is the distance from cemento-enamel junction to the entrance of furcation that can vary extensively. Okay, so it is a root trunk from cemento-enamel junction to the entrance of furcation. This is your actually root trunk. Okay, root trunk length. Basically, some teeth may have short root trunks, some have moderate root trunk, or some can have been fused to a point that is near to the apex. Okay, so basically, the combination of the root trunk length with the number and configuration of roots that affect the ease and success of therapy. Yes, root trunk length is one of the anatomical factor that actually affects the success or ease of the treatment. If the patient has the short root trunk of the effective tooth, so the less attachment needs to be lost, means there will be less attachment loss because the root trunk is short before the furcation is involved. Once the furcation is exposed, teeth with the short root trunks may have accessible to is more accessible to maintains the procedures. Short root trunks may also facilitate some surgical procedures also. Alternatively, teeth with long root trunks or fused roots may not appropriate for the treatment once the furcation has been effected. Okay, root length, which is directly related to the quantity of attachment supporting the tooth. Root length actually is basically how much attachment is actually supporting the tooth. Teeth with long root trunks and short roots may have lost the majority of their support. So they are seeing the teeth that have the long root trunks but short roots have a majority of their support may be lost by the time the furcation become effective. Teeth with the long roots but short to moderate root trunk length are more readily treated because sufficient attachment remains to meet the functional demands. So means they are saying the teeth which have the long roots and short root trunk, their treatment can easily be done because the furcation involvement is late here and the attachment loss is less. It is not sufficient, so it can be treated easily. But the with the teeth that have long root trunks and short roots, the attachment can be lost easily and the furcation involvement is actually late. Here, when they have long roots and short trunk, the furcation will early means, so it can be treated easily. The attachment loss will not be that much. But the teeth which have short roots but long root trunk length, their attachment is lost by the time when it reaches the furcation. So treat these things is very hard actually. Now moving towards root form when there is an individual root, so you consider that It's like mesial root of the most mandibular first and second molars, and the mesophacial root of the maxillary first molar are typically curved to the distal and in the apical third. Okay, so root form. In addition, when the distal aspects of this root is usually heavily fluted, means they are saying that these teeth, they are mesial root or either mesophacial root are mostly um, distally tilted in their apical third, due to which when the root aspect when the distal aspect of the root is heavily fluted, the curvature and fluting is actually increase the potential for the root perforation during endodontic therapy. So if there is a curvature and fluting is basically the formation of grooves. Okay, so they also increase the potential for root perforation during endodontic. When anyone doing this like restoration, and the anatomy of that person is like this, so it may actually hinder the treatment of restoration. It is a complicated post placement theory restoration, and this also increase the incidence of vertical root fracture. The size of mesial radicular pulp may also result in removal of most of this portion of the tooth during preparation. So what happens when the size of the mesial radicular pulp is there, means large, so it also been removed and most of this portion of tooth during preparation.